Perform hand hygiene outside of the patient room or in the anteroom. Either hand sanitizer or soap and water may be used. Put on your isolation gown. Placing your thumbs through the thumb loops. Tie the gown in the back. Put on your surgical mask or N95 respirator. If you are using an N95 respirator, wear the top strap high on the back of your head and the bottom strap around your neck, under your ears. Use fingers from both hands to press down the metal bar over the bridge of your nose. Perform a seal check by exhaling sharply and feeling for air leakage around the edges of the respirator. If air leaks, adjust and check it again. Follow manufacturer's instructions for performing a seal check. Put on eye protection, either a face shield or goggles. Put on gloves.